There's definitely situations where we have to modify treatment or reach out to their other healthcare providers, whether it be their primary care physician helping us manage symptoms of high blood pressure or diabetes, or whether it be reaching out to their endocrinologist for, again, assistance managing their diabetes in an effort so that we can continue a therapy as planned. There are definitely special considerations that we have to take into account when making treatment planning decisions with patients with colorectal cancer. There's definitely comorbidities that patients may be suffering from coming into prior to meeting with us that can make it difficult to adhere to certain treatment regimens, and we often have to work with other people involved in their healthcare team, whether it be their primary care physician or their endocrinologist, regarding tight control on their glucose so that we can adhere to their treatment regimen, or whether it be helping us manage their high blood pressure that could also be being exacerbated by treatment. So we definitely have to take in mind their other comorbidities when making treatment decisions and or trying to get them to maintain or adhere to treatment, because if we don't take a proactive approach and I kind of try and finely tune some of these other comorbidities that they're suffering from, it can lead to treatment delays, dose reductions, ultimately holding treatment altogether. So it's really important that we assess the whole patient, that we review all their healthcare needs, and that can be a wide range of issues, whether it be from neuropathy, from their diabetes. It can also be from even some other psychosocial issues that they might be having with trying to maintain the ability to come to the center, traveling, really taking into mind what people and support that they have in their life. And sometimes we also have to get the social workers' input and help with us so that they can help counsel the patient to make sure that all their home care needs are being met so that they can continue to come to the center. There's definitely a wide range of special considerations that we need to take into account when treatment planning. I would say one of the more specific considerations that we take into account with patients with later stage colorectal cancer is their performance status. Performance status is a huge part of making the decision on what agents to use and how much of it to use. So somebody that is already feeling ill or isn't functioning very independently, we may consider coming in with a lower dose of therapy, or if we were thinking about different treatment options, we definitely take into account how functional they are independently, knowing that the drugs that we are using will create fatigue and may further impact their ability to care for themselves. So it's definitely a huge part of our decision, the performance status and also what support they have at home. So definitely their ability to independently care for themselves is a huge part of the dose and the treatment itself when we're selecting therapy.